Hi, this is Anchor Shivani Gupta. I'm at Anicon 2022 in the city of Joy, Kolkata, and here with me I have.
Good afternoon to all my friends out there. This is Dr. Utsav Banerjee, consultant physician and neurologist. I also do have a lot of practice in cases of diabetic neuropathy as a whole internal medicine. And I have passed from Calcutta National Medical College, did my MD from IPJMER, Calcutta, and now I'm practicing in the areas of Howrah, Hooghly, and Burdwan.
Alright, sir. Here we are at IPCA. We are creating awareness about epilepsy, winning over epilepsy. So, sir, my first question to you is how far do you think that the treatment gap is there in India about epilepsy?
Well, unfortunately, miss, this is a very valid question. Like all other chronic conditions, for example, type 2 diabetes, hypertension, ischemic heart disease, there is a lot of lacking when it comes to awareness and patient education, specifically in the urban population or in the rural population. So, when it comes to the treatment of epilepsy, first is to counsel the patient to take the medications regularly and not to give a drug holiday. Yes, the dose can be modified, it can be reduced, it can be increased, it can be decreased, but most importantly, medications at proper time, proper interval checkup to the physician or to the neurologist, and most importantly to obey and to follow the advice of the treating physician.
Right, sir. And I would like to know what is the most common type of epilepsy which you treat in the adults?
There are different types of epilepsy, but as far as my own clinical practice goes, the most common and the most prevalent form of epilepsy which I see in my day-to-day clinical practice is generalized tonic-clonic GTCS or generalized tonic-clonic seizure. Sometimes the patient can also come with us some sort of partial seizure, but most importantly is GTCS, that is generalized tonic-clonic seizure, or sometimes myoclonic seizure also.
Right, sir. And I would like to know from you how far do you think that the unawareness is one of the reason of epilepsy in India?
Yeah, it is a very important question. Not how far, the question should be paraphrased as up to what extent. Unfortunately, in India, the lack of awareness and lack of proper education, as which is important with other chronic diseases, unfortunately, it is very much prevalent when it comes to the disease of epilepsy also. Like, for example, if the patient has a family history of epilepsy, first degree preponderance is there. The patient should be properly counseled that, see, if you are developing some sort of tremor, some sort of a sudden bout of syncope, if you are biting your tongue suddenly, then perhaps it is time to consult the local physician or to turn up to the neurologist. Don't ignore it, don't delay it, and don't collect your knowledge from your locality. Just come to the doctor with the presenting symptoms and get yourself adequately treated.
Right, sir. And many people think that, if you have epilepsy, you are not a normal person. But do you think that a person who is having epilepsy can lead a normal life?
Says who? Absolutely, it is normal. Be it any form of epilepsy, if the patient obeys the advice of the treating physician, if the patient, most importantly, if the patient takes his or her medication at a regular interval, if the patient is not irregular, if the patient is not non-compliant, so if the patient is very compliant, he or she can absolutely lead a healthy lifestyle. Not even a healthy lifestyle, with various methods, with various interventions which we have at our disposal, we can improve the quality of life of the patient significantly and drastically and markedly.
Alright, sir. One last question to you. What is the most common myth which you have come across about epilepsy?
There are a lot of common myths and common fallacies which are floating around in the society, unfortunately in India. Like, for example, some time back a patient came to me. She was a adolescent girl of 17-18 years of age. She came when she walked into my clinic. She was already on some sort of anti-epileptic medications. The first thing she told me, "Doctor, I think I won't be able to become a mother." This is one of the most common myths. Then I asked the little girl, "Who told you? Who told you, dear?" "No, my distant relative is telling me." The distant relative, unfortunately, in India knows much more than the doctor does. Again, I would like to debunk all these myths. If the patient, be it whatever may be the presentation of age, be it whatever the age the patient presents with some symptoms or the other of epilepsy, if the patient is taking medication properly, if the patient is obeying the advice of the patient, if the patient is turning up to the consulting physician or to the neurologist at regular interval, he or she can absolutely lead a normal healthy lifestyle, and he or she can complete the total life of the patient.
Right, sir. And one small message to all the people who are, suffering from epilepsy at the moment.
Unfortunately, with drastic improvement in medical science, you have absolutely everything to hope for. Don't get disheartened. Don't pay heed to these fallacies. Don't pay heed to these sort of unscientific jargon which are floating around in the society. You can live a totally healthy lifestyle. Just follow simple steps. Just take the medications properly. Just turn up to the patient regularly. Just turn to the doctor regularly. And most importantly, just obey the doctor. If you can do all this, you can easily live a normal, healthy life. Best of luck to everybody out there.
Thank you so much, sir, for joining IPCA winning over epilepsy. And I hope this is going to help a lot of patients out there. And I hope the positivity which sir gave to all of you is going to work in a long, long run.
Thank you, IPCA, for having me as a speaker for in this wonderful conference. I hope I could create some awareness in the society at large. I hope I could allay the fears of the patient who are suffering out there, be it any patient, be it with any form of epilepsy. Thank you.
Thank you so much, sir.